Well, good afternoon. It's been 3 months to the day since our government made the difficult but necessary decision to declare a provincial emergency. We pulled out every single stop to fight this virus. We used every tool at our disposal. We left absolutely nothing on the table. Our heroic frontline healthcare workers stepped up. Thousands of businesses stepped up. We had an army of 14.5 million people who went above and beyond. Our frontline responders put themselves in harm's way each and every day to keep us safe. Thousands of retired nurses and medical students enlisted to answer calls to Telehealth Ontario or help with contact tracing. 4,300 people put up their hand to help our seniors. Ontario businesses answered the call as well. We mobilized the manufacturing might of Ontario to support our healthcare heroes in the fight against COVID-19. Hundreds of businesses retooled their operations to make critical medical supplies and equipment. Thanks to their help, we've secured over 10,000 ventilators for our stockpile, 123 million masks, 4 million face shields, 173 million surgical gloves, and 21 million gowns. It was absolutely incredible, and I thank you. And when COVID-19 took a toll on people's livelihoods, we acted quickly to provide relief for Ontario families and businesses. Our government immediately developed a $200 million social services relief fund to support food banks, shelters, and those most in need. We put money back in the pockets of 1.5 million families by providing a one-time payment of $200 per child. We gave people a break on their hydro bills by providing a fixed off-peak electricity rate 24/7 for families, small businesses, and farms. We helped businesses stay afloat with a $10 billion relief package, including tax deferrals and WSIB premium relief. And we worked with our federal partners to set up a $900 million commercial rent relief program to help small businesses through these difficult times. My friends, in 3 short months, we have made tremendous progress, and we're not going to stop. We have to keep going. Because of that progress, because of our collective efforts, more businesses are opening their doors. More people are going back to work and taking home a paycheck again. And we all know all of Ontario will join them very soon. But we must remain on guard. My friends, make no mistake, tough challenges lie ahead. But I'm confident Team Ontario will come back and come back stronger than ever before. If we stick together, if we keep looking out for each other, we will chart a path to a strong and prosperous recovery. Thank you, and God bless the people of Ontario. Now I'll invite Minister Elliott up to say a few words. Thank you.
Thank you, Premier, and good afternoon. To say that the last few months have been unprecedented would be an understatement. It's been a time defined by its disruption, not only to our health system and economy, but to the lives of every single Ontarian. Nearly 5 months after identifying our first confirmed case of COVID-19 and 3 months after declaring a state of emergency, there are unmistakable signs that we're making real progress in our fight against this virus. For the 4th day in a row, Ontario reported fewer than 200 new cases of COVID-19. And for more than a week now, Ontario has added more resolved than new cases, meaning fewer and fewer active cases in the province. In fact, since Tuesday of last week, there are over 1,400 fewer active cases in Ontario. Hospitalizations, ICU admissions, and patients on ventilators also continue to decline. Every day, a clear majority of public health units report fewer than 5 cases, with many of them reporting no new cases at all. With Ontario continuing to lead the country in daily testing, our positivity rate remains at all-time lows. Our journey as a province has not been without loss. But during these trying times, we've also seen the very best of our province. Retired nurses and doctors joining heroic frontline workers, each of whom put themselves in harm's way to keep our families safe. Businesses retooling production lines to help manufacture desperately needed supplies. And neighbors coming together to do what may seem like the simplest of gestures, banging pots and pans in the evening, but which serves as a daily reminder that here in Ontario, we always have each other's backs. Because of this shared resolve, we are able to continue to safely reopen our province as each of us adjusts to our new normal. As we do, more and more families are going back to work. Ontarians are safely enjoying each other's company as they build their social circles. Scheduled surgeries are resuming, helping more Ontarians receive the care they need and have waited for. And friends, family, and caregivers are reuniting with loved ones in long-term care homes, retirement communities, hospitals, and other residential care settings as visits resume under safe conditions. None of this would have been possible without the strength and determination of all Ontarians. Together, we will continue to stop the spread of COVID-19. We will beat this virus. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Julianne Lamoureux from Radio Canada. Please go ahead.
Hi, Julianne.
Hi, good afternoon, Premier. We've come a long way in terms of testing in the province. So we've been at over 20,000 pretty much every day for the last few days. How did we finally manage to make it happen after so many challenges? And what's next? Is there a new target as the economy reopens? And when do you want to see more testing being done?
Well, I'll tell you how we ended up getting there. We changed the strategy. I know Public Health was working extremely hard, and they were maxed out. We brought in Ontario Health, Matt Anderson, and Dr. Heyer. I gave him a shout out yesterday. Because of those two folks and their teams, that's the reason we're able to reach over 20,000. And I'm so proud of them. We've tested over 1 million people now in Ontario. So congratulations. But we aren't going to take our foot off the pedal. We're just going to continue testing until we don't need to test any longer, and hopefully that will come sooner than later.
And you just talked about the fact that it's been 3 months since the declaration of the state of emergency. I was wondering, what have you learned in those last months, and how will it have changed you as a leader?
Well, I think what we've learned, everyone's learned across the country. Just amazing how the businesses stepped up, people stepped up, our frontline emergency service folks. We just came together as a team. And what I've learned, and I think the people of Ontario and Canada have learned, is when we're all pulling in the same direction and we're all working together, it doesn't matter what political stripe, if you're from the green, the orange, or red or blue party, we need to work together. We didn't play politics, the federal level. They did a great job. Municipalities didn't. And I just ask, other people from other parties, be it opposition or not, work with us. It's easy to sit back and fire shots, but it's not worth it. People don't want to see that. They want to see us all working together, and that's exactly what we've been doing.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hello.
Hi, Cynthia.
Hello, Premier.
Hi.
Listen, today, doctors at the Hospital for Sick Children released a report strongly recommending that kids go back to school in September. And they say they're losing sleep over the ramifications socially and mentally on children. But many educators are very concerned that they're not going to be protected, that maybe it doesn't spread amongst children, but some of them are older or immunocompromised. So how will you protect educators when school does resume, presumably in September?
Yeah, well, first of all, I want to thank Sick Children Hospital. They're an incredible hospital, and I know we've been consulting with them. We're going to continue to consult with them and other stakeholders, and we just appreciate it. So thank you. I know Minister Lecce will be rolling out a plan over the next little while to make sure our kids are safe. I will not risk, and I've said it right from day one, I'm not going to risk anything that puts our kids in jeopardy. I'm just not going to do it. And now for the teachers, we're going to make sure we sit down with the unions and discuss a strategy to make sure they feel safe, because they're so important to our children. They're so important to the education system. And I want to thank all the teachers out there. They've done an incredible job through this pandemic with the online courses and getting on there and teaching our kids as we went through this pandemic. But we'll have that discussion with the unions, and I want to thank them, and we'll never do anything to put our children at risk.
So, Premier, if a teacher is older, immunocompromised, or caring for a family member that is immunocompromised, will their job be protected? How will they be treated so that they don't suffer consequences?
Their jobs will be protected just like everyone else's job is protected, and we're going to work with them and come up with a solution through their unions and through the ministry.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Premier. Since in the last 3 months, there's been many emergency regulations passed. Some of them are relatively progressive, like allowing alcohol delivery and takeout from restaurants, curbside pickup cannabis from illegal marijuana stores, and the creation of what are essentially virtual courtrooms. Are some of these regulations going to become permanent? And if so, which do you think would be a good idea to continue on after this thing's over?
Well, we've been pretty flexible. We wanted to make sure that the companies could stay open and have the flexibility to deliver their products to the public. And that's something that we're going to have to review, Randy, because a lot of it has worked extremely well. And the new way of doing business, no matter if you're in the private or public sector, things have changed. And I think we can do things a lot more efficiently moving forward and learn from the lessons over the last few months.
And also, we see a lot of the civil service, the public service, working from home. Mm-hmm. Can you see, there's benefits to that in that there's not as many people on transit, there's not as many people in the roads. Can you see that continuing, that some of the civil service will continue to operate from their homes after this is over, as opposed to going into offices?
Well, that's a conversation I'll have with the Secretary of Cabinet and sit down with him and see when people can work at home. That's great. But there's another whole, Randy, there's another whole social aspect about going to work. Some people rely on going to work to meet their friends and their fellow team members. And there's a whole other side to this about the social aspect and interacting rather than sitting at home all day. I know you can start going squirrely working at home all day if you don't have interactions with your coworkers. So that's something we will discuss with all the different ministries and with the private sector too. I've heard both sides of the story on that.
Next question.
Next question comes from Colin DeMello from CTV. Please go ahead.
Hi there. Good afternoon, Premier. I just wanted to return to what Sick Kids is recommending for schools. So one of the main recommendations is that they will be able to reopen schools, or schools can reopen in September for in-person learning. Is that a recommendation that your government is going to accept, that schools can return in September?
Well, we're going to listen to the experts. They're the experts. Our health team's the experts. And I'm not going to waver from that. As long as the healthcare experts, including the Sick Kids Hospital, if they think the green light's good to go, then we're going to follow their lead, and we're going to put in really stringent protocols. And I know Minister Lecce will be rolling that out shortly.
Okay, appreciate that. And just on the economic recovery, Premier, we've seen in the two regions that are not reopening, including Windsor, but in Peel and Toronto, it seems like the numbers dipped yesterday. They're back up today, so there is some fluctuation. I'm wondering about the timeline. Your government has said there will be reopenings every Friday. Is that firm, or can Toronto and Peel open earlier than any given Friday in this?
Well, before I send it over to Minister of Health, I just want to be very clear. Every single jurisdiction, all 34 jurisdictions, even if we give them the green light, if they want to continue to keep the shops closed, that's going to be up to them. And they know they have the powers to do that. And we're going to take the advice off the Chief Medical Officer and the health table. I just hope, we can open up as quickly as possible. I'll pass it over to the Minister.
We do certainly hope that they'll be able to come back as quickly as possible, but the system has been set up that we're looking at things on Mondays, making a decision about an opening on the following Friday, so that businesses in certain areas will be ready to be able to do that. We give them as much notice as possible, but what happens is we get the data in for every day. We get the data in for on Sunday about 5 o'clock, and then the data is reviewed by the Chief Medical Officer of Health and the other public health officials at the Health Command Table, and they make that determination as to what the rate of cases has been for that period up to and including the information that they receive on Sunday night, and then they make the determination on the Monday about whether that can be opened up or an announcement made about it opening up for the subsequent Friday. So we're going to continue to do that. It worked well for the 10 groups that are going to be opening on Friday, and we'll continue to do that with Peel, Toronto, and Windsor, Essex as well.
Next question.
Next question comes from Travis Danrash from Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. 1,794 seniors have died in long-term care, and Global recently did a report on the worst-hit homes and who runs them. Sienna has lost over 295 residents, and Rivera has seen 230 deaths. Now, the Ontario Health Coalition says it is now irrefutable that for-profit homes, the larger chains in particular, have a strong correlation with the highest death rates of COVID-19 in our province. So, simple question, do you agree that there is a correlation, and do you think that these owners should be shielded from civil lawsuits?
Well, let me tell you about that, Travis. First of all, we've called an independent commission, as you know. The Auditor General is calling audit, and so is the Ombudsman, along with the possibly the police, the coroner's office. But let me be very, very clear. I'm not supporting bad actors. And not only that, I'm not even supporting bad actors. I'm holding these people accountable. When we get through this whole process and find out exactly what happened in these homes, there's going to be accountability. There's going to be accountability for the people we've lost. We're going to be accountability for the companies that let this happen. Because there's absolutely no excuse after that report from the military, any human being, not to mention the most elderly, the most frail, the most vulnerable in society, were treated the way they were treated, and they'll be held accountable. And I'm not protecting any of those bad actors. So I'll make myself very clear on that one.
Okay, and on another issue, some frontline workers say the government is dodging them by not addressing the fact that they have been left out from pandemic pay that other essential workers are getting. Many are protesting on the lawn of Queen's Park. What would you say to them, and why don't they deserve a bump up in pay like everyone else?
Well, as far as I'm concerned, everyone deserves it. And we put 375,000 people with a pandemic pay. I think they're heroes. They've done an incredible job. We've spent every penny the feds have given us, and there's just no more money left. I wish I could pay everyone. I really do, and that's about the answer. We've covered as many people, as many areas as possible, and 375,000 people. They're a lot of people, and I'm sorry. These people are heroes as far as I'm concerned, and they've done an incredible job. And I wish we had the money to pay everyone.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Premier.
Hi,
I wanted to ask you in that vein, on the last few days we've seen the grocery stores announce that they would not be paying the pandemic premium anymore. And you spoke during the pandemic, at the height of it, how these folks were frontline heroes and they deserved every penny that they were getting.
Yep.
Do you think that the grocery stores are making a mistake reducing this pay at this time? I mean, we're not through the woods yet.
Well, I can't comment on the private sector. That's going to be up to each and every company. Every company's different. So that's going to be up to them. And I do think they're heroes. We talk about all the heroes. Just imagine the cash register clerk that they've stood there day after day cashing everyone out, and just imagine all the people they've been in contact with. They're heroes. There's a lot of heroes out there that have helped us through this.
And to follow up, today the government's introducing legislation to ban commercial evictions to help small businesses. I guess it's going to be retroactive to May 1st.
Yes.
I'm just wondering if you're having any second thoughts, and maybe if you could do this again, if you would have done it a little bit earlier, because so many businesses have, of course, been hurt by the pandemic.
Well, we backdated back to, made it retroactive to May the 1st, and I was begging, trying to get the landlords and the tenants to work together, and I kept telling the landlord, I remember coming out here numerous times, please, I was begging him to work with them, and a lot of them didn't want to work with them, so we had to do what we had to do, and I don't regret it. I got to protect the little guy. I'm going to always protect the little business, always.
Next question.
Next question comes from Christy Lee Varley from AM 800 Radio. Please go ahead.
Hi, Christy Lee.
Christy Lee.
Hi there, sorry. Hi, Premier.
Hi.
Here in Windsor, Essex, there is a lot of debate about testing of temporary foreign workers, and our medical officer of health said today that upwards of 300 workers in this area alone have tested positive. So do you have a straight answer on who can mandate testing among these workers and why it hasn't been done yet?
You can't force anyone to get tested. That's the thing. So we have 8,000 workers down in the Windsor, Essex, 3,000, and total 11,000 other places in the province. I want the farmers to work with us. And I absolutely love the farmers, but sorry, Windsor, the hospital, had to close down the testing site that I announced yesterday because no one was showing up. Like, I'll do anything. I'll send buses. We'll send mobile units, but if we send mobile units to every single farm, it's going to take 80 days. If we can get these workers in and get tested, but no one showed up, so the hospital closed it down. Please, to the farmers and the workers, I understand the reluctance. In some cases, they're worried, they're scared, the workers. There's no reason to be scared. Just please get tested. I can't stress it enough. I don't know what more I can do outside of going there, and I can't force anyone. But there's a reason why they aren't sending their workers, and the workers aren't showing up. It's just not fair to the rest of the population. That's how I can phrase it. I got to protect the population. We need you to work with us. Please just go get tested. If you need transportation, we'll send buses there to pick you up and bring you over to the testing site, whatever it takes. I just can't force people to get tested. I just can't do it. So we're asking for cooperation from the farmers, which we love.
Follow up.
And we know that the local medical officer of health here gives the province the data that you require to enter stage 2, and the decision then is made at your level. So can you say, is it strictly the temporary foreign worker issue that is keeping Windsor Essex in stage 1? Because people down here, were first quick to blame our proximity to the U.S. and essential workers crossing the border, but we saw Sarnia Lambton given the green light this week. So is it just this issue of the foreign workers keeping Windsor Essex in stage 1?
Well, I'll pass it over to the Minister of Health for this.
The issue of the migrant workers is the biggest issue that relates to Windsor Essex that's preventing them from moving into stage 2. But there are also quite a number of workers, particularly in the healthcare sector, that also live in Windsor and work in the United States and go back and forth. So I think that situation is a little bit different than Sarnia Lambton, but those two factors are the principal issues that we're dealing with in determining whether Windsor Essex is, at what date they're going to be able to move into stage 2. So that's why, as the Premier indicated, we really are working very hard with OMAFRA, with Ontario Health, working with the farmers, working with the federal government, trying to find a solution that's going to work for testing of the migrant workers. It's probably going to be some kind of a hybrid solution with an assessment center, as well as having people go in mobile units from farm to farm because there's many workers in this area, as the Premier stated. It would take 84 days if we did it just with mobile testing units, only 10 days if we did them all through assessment centers. So we're working with the Ontario Health and with OMAFRA to try and come up to a solution that's going to be suitable, that will allow people to be tested. We can't force anyone to be tested, but we can make the circumstances for them to be tested if they wish easier.
Last question.
Last question comes from Christina Tanalia from CP24. Please go ahead.
Hi, Christina.
Oh, I was on mute. Hi, Premier. Thanks for taking my question.
Thank you.
On the issue of the border, today Prime Minister Trudeau was asked about, the potential for NHL players to come over to a potential hub city and cross over into the border, and that frustrates a lot of families. I've been hearing from families who have not seen their loved ones, their partners, they're estranged from them in the U.S. because of the border closure. Now, I know you have your weekly calls with the Prime Minister, and last week the border was discussed. Yep. Do you support a closure of the border past July the 21st? And in your recent call with the Prime Minister, was there unanimous support for the continued closure of the border?
Well, I mentioned, and so did Francois Legault, mentioned that we want the borders closed. Let's see where we're at when it comes to that point and review it. But, as for the NHL, that's going to be up to the federal government. They're the ones that, at the end of the day, are going to allow them to either self-isolate for 2 weeks or not. And if they decide to have them self-isolate for 2 weeks, I guess the NHL won't be coming to Canada, and that's fine. Whatever works. I think it would be great for Toronto personally. They have some stringent testing requirements the NHL has put in place. They said they were going to test their players every single day, even though the medical advisors have told me they don't need to be tested every day, but they're going to test them every day. They'll keep them self-isolated from point A to point B, from the hotel to the rinks. So the NHL's gone above and beyond what they need to do, but again, it's going to be up to the federal government to make that decision. I would, in August 1st, I personally would like to see the NHL, but I'm not making that call. The feds are.
But Premier, after July the 21st, do you think the border should reopen?
Well, something, Christina, asked me that on probably July the 19th or 18th. I want to take a look at the numbers just to make sure I could say yes today, and all of a sudden the numbers start spiking up. But what makes me nervous, two things about the border. We're butt up against Michigan and New York State. I think they're 1-2 in cases, or maybe 1-2-3. They're in the top 5, let's say, of cases, and that concerns me. It actually really concerns me. And then up on the top north part, we have Minnesota. We have a lot of border crossings, but it's up to the federal government if they decide to. My request to the federal government, enhance the screening when people come across the border. Because it just wasn't happening before, and I don't want to come across, I'm criticizing them, because I'm not. They've done a great job, but man, we got to do a much better job at the border. They need our help. That's fine. We'll put people on the border too, and if they aren't doing it, we're putting people on the border anyways. So we'll see how this turns out. Hopefully we'll see the numbers go down by that time.
Thank you.
Thank you, everyone. Thank you.